All right, Dr. Darien is back now, and he's taking a look at some of the questions that you, our viewers, are asking. And here's one. How are stomach ulcers diagnosed, and what foods, drinks should I avoid if I think I have one? That's from Marie.
Such a common diagnosis. Stomach ulcers, we call them in the hospital peptic ulcers, gastritis, a common cause. So things you want to avoid: greasy foods, alcohol, caffeine, citrus can sometimes irritate it. So lemons,
All
limes,
the things that I love.
Acidic foods, tomatoes. So these are the things you want to avoid, but also figure out what's the cause. The two most common causes include overuse of something called NSAIDs. That includes things like ibuprofen. That's one of the most common cause of ulcers.
Wow.
And so that's why it's an important question to ask if a patient has pain, for example, because then you find out they've been taking ibuprofen way too much. And also an infection called H. pylori infection. It's a bacteria that causes ulcers. You need to make sure you rule those two things out when you're getting worked up for this problem.
Oh, wow. Your prescription for wellness?
How to take a tablet. And so swallowing pills can be really difficult. As we were talking about during the break, sometimes people think it's only for kids, but as a physician, I know very well that many adults cannot swallow a pill. So here are some tips that you can use that I help patients with. Number one, use a water bottle. Fill it with a drink of your choice. Put the tablet on the back of your tongue, and when you're drinking the water bottle, make sure you have a good connection and you don't allow air in. That's one of those tricks that can help you avoid the mentality while you're thinking to yourself, I don't want to swallow this pill. The second one, leaning forward. So while you're sitting up straight, you want to put the tablet on your mouth. You want to take a sip of water or whatever drink you wish to have, and then lean forward and swallow. And it helps you to avoid the sensation of the tablet because a lot of it is around that sensation. Also, mixing the pill in something like pudding or applesauce. When you pick it up from the pharmacist, you can ask them if it's crushable. If it is, that makes it a lot easier that you can mix it in your food. And then lastly, use a straw. These are some of the methods that I use in the ER when I'm trying to get my patients to swallow a tablet.
Mixing it in applesauce, I like that one.
Yeah, and you'd be surprised, I do it for adults too.
All right, Doc, thank you very much. And folks, we would love to hear from you. So hit us up on Instagram with all of your medical questions at ABC GMA3.
Well, hey there, GMA fans. Robin Roberts here. Thanks for checking out our YouTube channel. Lots of great stuff here. So go on, click the subscribe button right over here to get more of awesome videos and content from GMA every day, anytime. We thank you for watching, and we'll see you in the morning on GMA.